Thank you. Today I'd like to talk to you about heartworm disease. If you own a dog, chances are you give your dog a monthly preventative that your veterinarian prescribes you, and you've heard about heartworm disease and you know you need to do that preventative. If you're a cat owner, chances are you've heard of heartworm disease but may not really know much about it. So I'd like to just talk to you a little bit about what it is and why it's so important that both dogs and cats get preventatives on a regular basis. Heartworms are a parasite that is transmitted to your pet through a mosquito bite. And if you live in New England, you'll know that mosquitoes don't just always live outside. Many times they come into the house and they find us. So they're looking for little heat, warm bodies, and your animal has a body temperature of at least 100 degrees. So those mosquitoes are going to find your animals just as quickly as they might find us. The worms are injected into the body through the mosquito bite, and over the course of a 6-month period of time, those worms will grow slowly larger, leave the bloodstream, migrate through bodies and the tissues. And in dogs, they actually end up in the right side of the heart, in the pulmonary artery. This is why heartworm is so dangerous. Those worms will affect the ability of your heart to pump blood to your lungs, or to the dog's lungs. And if the worms die, those worms are going to let go and end up in your pet's lungs, which can create devastating side effects for the animal. Preventatives work. When you give that preventative, it will kill any of those baby mosquito bites that you got, the larva, kill the larva so that it can't grow into an adult heartworm. It literally works on heartworms your dog or cat may already have in their body, which is why giving it once a month is immensely important. It's also super important that we do year-round. We do know in New England with all the climate change, we are sometimes seeing mosquito season wrap around into what we normally call winter or an early spring. Giving it monthly makes sure that you never put your pet at risk for a heartworm infection. Now in cats, it's a little bit different. When those little larvae are working their way through the body, in the lung tissue, the cat has a really intense inflammatory reaction that will cause a lot of breathing difficulties for your cat, coughing, exercise intolerance, lethargy, and in really severe cases, they feel very sick and down and out. In many cases, a veterinarian may try to diagnose those cats as having asthma. The bottom line is that the only way to tell if it's from heartworms or if it's truly asthma is to take a lung biopsy, which of course we're not going to recommend. But the treatment is oftentimes very similar. But the good news is if you give your cat a monthly preventative, you can prevent them from ever having to deal with that respiratory illness. In addition, it's important to know that statistically, 1 out of 4 cats that are tested positive for heartworm actually are indoor cats. That's mind-blowing when you think about it, but it makes sense, right? So we want to make sure that everybody knows the importance of using preventatives. Okay, there are some additional resources that we can provide you on the community television website. It will bring you to the American Heartworm Society website, but there's also one put out by the American Academy of Feline Practitioners specifically about cats and heartworm disease, and we'll share that as well. Feel free to talk to your veterinarian about which preventative would be right for your pet.